I'm Dr. Stephanie Kappel, a cosmetic dermatologist in Newport Beach, California, and today I want to talk about dark circles under the eyes. What causes them, what treatment options are available, and I saw just a few people in my clinic just today who came to see me to kind of talk about different options for removing under eye dark circles. So I thought to myself, I wanted to film a video tonight, and the topic I felt should be dark circles under the eyes because I saw a handful of people with that complaint today. So if they had that complaint, maybe other people do too. And after watching this video, you can maybe learn about different treatments for dark circles and the various causes of dark circles under the eyes and different things that we can do non-surgically to correct them. So this is fun because I'm at home in my bedroom, like I'm winding it down after a long day, a long busy day, drinking my chamomile tea, and I just love connecting with you guys. So I love talking about various topics that you guys want to hear about. So drop a comment in the comment section and let me know what else you want me to post about because I love engaging with you. And I love that I found my family of skin nerds who love skin as much as I do. So I've dedicated my whole life to studying the skin for like 20 years. And I just love talking about skin science and debunking skin myths. And I just want to be a source of truth and honesty in dermatology and aesthetics, which is a rapidly advancing field with constant new technologies that's coming down the pipeline, whether it be in skincare, active ingredients, devices, lasers, treatments, all of that stuff. So it's so fun to have you join me, and please join my skincare family and my skin nerd family on YouTube. And I'm super passionate about it, and I'm just so happy that I found my skin nerd family who I can like dork out with, and you guys still support me no matter how nerdy or scientific I get. So let's talk about dark circles under the eyes and what are the causes of them and what can we do to make them less noticeable or less apparent. So there's various reasons that you can have dark circles under the eyes. It could be based on anatomy, your genetics, your exposures, and various other factors that come into play. Age, anatomy, and skin thickness, things like that. And so every individual person may have a different cause or contributing factors that are making dark circles under the eye. So it's important to know what treatment is indicated to address each mechanism of action, which is going to make the dark circles look less apparent. And sometimes it's a combination of therapies. And if you're a patient of mine, you know I'm very conservative and I like to do successive approximations to your goal because sometimes it's important to see what treatment is doing what. So instead of doing, you know, a Fraxel and a Pico and some tightening with Thermage and then some filler, you don't want to do too much too fast. You want to do one thing and see how you react and then move forward and do another treatment if needed to kind of have successive approximations to your goal to help lighten up this area, because this is an area that can make us look tired or make us look sick or make us look older. And whether, even if you are young and you have thinner skin and your vasculature showing underneath there, can make the under eye circle look dark and make you look older than you are. Or say that you never had dark circles before and now that you're over the age of 40 or 50, the dark circles are starting to show. Or say you're a new mom, we've all been there, and you have a newborn that's keeping you up all night and you have a toddler that's running around and your lack of sleep and it's showing in your eyes by making you look sunken and tired and fatigued. So different things that we can do to brighten up the eyes, and I kind of just want to break it down so that you know different treatment options that are available and what one may be best for you, and it may be a combination of different therapies as well. So one reason that you may have discoloration or dark circles under the eyes is the underlying vasculature that lays underneath the skin. So like a bluish purple hue under the thin skin of the under eye area or the infraorbital area can make us look like we have dark circles there. Even if there's no volume loss, even if there's no melanin or pigmentation there, the blue purple vessels underneath the eyes can make us look tired or older or exhausted or sickly. And so doing V-beam, which is my favorite laser for erasing dark circles, there's other lasers too that are vascular lasers that have hemoglobin as the chromophore, not to get too scientific, but there's XLV, there's KTP, there's V-beam, there's IPL, but V-beam's my favorite because it's the best laser at getting rid of that discoloration that's usually from underlying vessels. Now, say you anatomically have thin skin there and a lot of blood vessels, a vascular network that's pretty dense under the skin of the eye right here, and you do a couple V-beam treatments and they fade. Usually the maintenance is maybe like every couple years they may come back, and they may not come back at all. And say that, you're younger and it's more of an anatomical reason. Well, somebody who may not have had dark circles before may get dark circles as they become older, and the epidermis and the dermis and the subcutaneous fat thins as we get older. Unfortunately, it's just a truth. It happens, but that's okay because we can do things to make it less apparent. And as you get older, you can start noticing kind of like a purplish, bluish hue underneath the skin that can make us look tired. And that happens as the fat pads in the skin thins over time, showing that underlying vascular network making it more visible than it was before. So usually V-beam is the laser of choice in my office, at least, and I have great results with using V-beam. So people who rely on concealer or are always trying to cover up that area, after 2 or 3 V-beam treatments spaced about 1 month apart, they no longer need the concealer and they can just jump out of the shower and go without having to hide the dark circles under their eyes. And it's very liberating just being able to correct skin ailments with lasers and not have to worry about covering things up with makeup, and you could just get up and go, especially when you're a working mom with kids, and we've all been there, and I'm there right now. So I think that V-beam is one of the best treatments. Again, there's other lasers that can help target that vasculature, but the downtime is not bad at all. It's usually about 4 or 5 days of some swelling, but not too much. It's not like your eyes are going to be swollen, but a little bit of swelling that actually looks kind of good. It looks like there's filler under there when the under eye area is swollen, and some redness. Now, not redness and bruising. Like sometimes my patients will Google V-beam before and afters, and a lot of doctors who don't know how to use appropriate settings, they use something called purpuric settings with a very short pulse width, and they're just not doing the right setting. So you shouldn't have any bruising. You should have maybe a little bit of pink redness, but nothing too gnarly. Like the downtime is not bad. You wouldn't want to do it like before a big event or like a wedding or a birthday party, where you have like a busy social calendar. But if you have it done and you got to dinner with your friends, they're not gonna be like, what did you have done to your face? Like, what's going on? So it's not that, the downtime's not that bad. So another cause that can cause dark circles under the eyes is melanin or pigment. And this could be due to your genetic makeup or your background. And if you look at your parents or your grandparents, they may have dark circles under the eyes too. So that skin is so thin and it kind of gathers and collects right there. And the melanin in that skin can be more dense because the skin is kind of more crepey there and thinner. And when it gathers, it just looks darker. So in that case, you can use lightening agents like skincare products that have brighteners in them. So hydroquinone, I would avoid vitamin C in that area because vitamin C and retinol, I'm not a big proponent of vitamin C and retinol in eye serums because they can cause post-inflammatory hyperpigmentation from irritation, which is like going the other way and can be totally counterproductive. But you want to use skincare products that have natural brighteners. So hydroquinone and some non-hydroquinone skin brighteners. Azelaic acid could sometimes be irritating, but is a little bit more mild. Kojic acid, just different non-hydroquinone brighteners to help lighten up the melanin pigmentation under the eye. Or you could use a laser, but of course you want to use a laser that's going to relieve the melanin and the pigmentation, but not cause post-inflammatory hyperpigmentation. So although I love Fraxel for under eye wrinkles and laxity and for tightening the skin under the eyes, it's not my favorite for reducing the appearance of hyperpigmentation under the eyes because of the risk of post-inflammatory hyperpigmentation. I do love Clear and Brilliant. The 1927 nanometer handpiece is amazing at erasing dark circles under the eyes, especially if you combine it with diligent sunscreen use, and I love the Color Science 3-in-1 Total Eye, or if you use a YAG laser or a Pico. So Pico Sure and Pico Way are a Pico laser, so they basically have a photoacoustic because they're so fast. The pulse, of the laser is so fast, it's a picosecond, which is like a trillionth of a second. And what that translates to in English, not trying to be too physics oriented or scientific or nerdy, but I know you guys like that too. It basically doesn't have any dissipation of heat because it's so fast. So it's safe in Asian skin types, darker skin tones that are more predisposed to hyperpigmentation. So it's really great for erasing under eye discoloration safely and effectively without the risk of making it darker. So I love Pico and I love the Clear and Brilliant 1927 nanometer handpiece laser for reducing dark circles that are due to melanin deposition or pigmentation. So another reason for hyperpigmentation under the eyes that's not genetic can be post-inflammatory hyperpigmentation that I just mentioned before. This is one of the main reasons why I'm not a big microneedling fan. I know a lot of my colleagues love microneedling, and I actually was very excited about it when it first launched back in like 2014. I actually did a Good Day LA segment on the news on microneedling and this new technology, but I've seen a lot of hyperpigmentation from patients having that done not only in offices but at home too. This one patient we we were able to correct it, but she had an at-home like kind of microneedling pen, and she was young. She was only 25 and was doing it more for preventative measures to erase under eye wrinkles and fine lines and to kind of prevent, fine lines and wrinkles from forming. And she got really bad post-inflammatory hyperpigmentation under the eyes from the microneedling. So we were able to reverse it. I used the Clear and Brilliant 1927 nanometer handpiece laser, and I used a hydroquinone. We were able to lighten it and brighten it, but I'm not a big fan of things that are going to hyperpigment, because you're correcting one thing and you're causing a side effect that's worse than what you're treating in the first place. So on that note, if you do have hyperpigmentation from some type of traumatization, say you overuse a retinol, or say you do have microneedling or a Fraxel or a laser that hyperpigments, then the best way to relieve that pigmentation is with the Clear and Brilliant 1927 and the Pico as well. And again, I just want to go on a tangent one more time and just say that even though I'm not a big microneedling fan, if somebody has the treatments done and they love it, I want to take this opportunity to say, if it works for you, that's fine. Everybody's entitled to have their own recommendations or, stand behind certain procedures or products, and we're all a product of our experiences, right? If I'm seeing a ton of patients getting referred to me from the office down the street because of microneedling complications, I'm not going to be a big fan of microneedling. Or if I work in an office where I had microneedling and lasers and I get much better results with the lasers and consistently more happy patients with the lasers, I'm not going to be a microneedling fan. So that's why, and I think it's really important to just keep that in mind, not only with microneedling, but any topic, whether it's exfoliating, whether it's, double and triple cleansing. Some dermatologists say do it, some say don't, some say use tretinoin, some don't. So I just want to throw that out there because we got on this topic, and I think it's really important to remember to just take that with a grain of salt. And as dermatologists, we're all a product of what we see in our offices and what our patients are reporting back to us and what we see in the literature. So if I recommend something that somebody else doesn't, or vice versa, just take it with a grain of salt and take what advice you feel is best for you. So I say this in every video, and I want to make it very clear. I have zero paid partnerships. I never have, and I never will be paid by company to promote a certain product. I want the autonomy and the freedom to recommend and promote to my patients and my followers what I believe is the best treatment, and that may change. Aesthetics and dermatology is a rapidly advancing field, and what I like today, there may be something that comes along better next week, and I'll recommend that one if I'm seeing good results with it. So I'm very evidence-based, and I will never be bought or sold by a company, and I love the freedom and autonomy to just post and recommend for you guys, which I know truly works and what I stand behind and I believe in, not because I'm being paid by some company to do that. And I'm true to that. I've been true to that since the day I graduated residency and fellowship. Okay, on that note, moving on. So another cause for dark circles under the eyes can be volume loss. Now, this can happen as we get older and the tear troughs, the kind of little hollows under the eyes where the eyelid-cheek junction connects here, can become more sunken as we lose volume as we get older. So, we lose volume from the subcutaneous fat pads that basically thin out and separate and can cause a darkening or a hollow here that's not really a pigment or a vasculature cause of a dark circle or dark hue under the eye. It's just because there's a shadowing effect because there's a little hollow there. Now, that can occur with age, and in that circumstance, usually tear trough filler is the answer to kind of fill in that volume loss so the shadows aren't being casted to make it look dark under the eyes, which can make us look tired or exhausted or older. Another thing that can happen is just an anatomical variant that can have some volume loss in the tear trough area. My daughter, who is in first grade, always says, "Mommy, I have tear troughs." So she probably should not be around me when I'm posting so much because she's way too young to worry about that. But she has anatomical little hollows and little dark circles under her eyes. So, it could just be part of your physiologic anatomy. And once you get to a certain age or once you get older, if it becomes more pronounced, then we could do different treatments to kind of help with those dark circles. Or, you may just accept them and just know that that's just part of your anatomy, and that's okay too. But it's important to understand the reason why you're having the dark circles so that you don't go to a provider who treats you with a V-beam laser when it's really a volume loss issue, and vice versa. So I also wanted to make a point. For tear trough filler, it's a highly advanced injection technique to treat the under eye area. I use a cannula. Sometimes I don't, but I most often do. And I actually served on the advisory board for Allergan when they received the FDA indication for tear trough filler with Vobella. So, I have a lot of experience doing it. I've been doing it for about 10 years off label, but it's really important that if you are going to have tear trough filler, that you go to an expert who knows what they're doing to fill in that volume loss, because, the ramifications can be catastrophic if it's done incorrectly with the wrong injection technique. And I was always told by my attendings in residency training at UCLA, I remember they always said, if you can't reverse a complication that happens from, that injection site area, then you shouldn't be doing it in the first place. Because, sometimes I've had colleagues who are the ones on the other end of a phone call of, a clinic down the street saying, okay, I blinded the patient stroked out, the patient can't move, and you have about an hour worth of time to reverse a complication if it happens. So if they can't do that themselves and they need to call on the dermatologist down the street to reverse the complication, in my opinion, I don't think that they should be doing it. And don't be afraid as a patient to question your provider. Say, are you comfortable with this? How long have you been doing this? Do you use a cannula? And if you don't, why don't you use one? Did you not do advanced training to learn how to use a cannula? Let me see your before and after. What are you going to do if I have a complication? Is blindness a risk of tear trough filler? So not to scare you guys, but I really want to empower you guys. And, whatever provider you see, if you're trusting him or her with your face, and, the complication rate could be quite high and catastrophic if not done correctly, don't be afraid to ask your provider these questions. My patients come in asking me this, and I love it. I know that they've done their research. I know that they've looked me up online and looked at my Instagram and looked at my YouTube, and I love that that's why they came to see me, and they waited 6 months to see me. But it's really, really important. So don't ever feel uncomfortable or don't feel bad by challenging your injector. And if they feel uncomfortable or hesitant, trust me, you'll be able to see within minutes if he or she isn't comfortable doing tear trough filler. So not to go out on another tangent, but I like to throw as much information at you guys as possible to empower you and to give you the knowledge to avoid complications and have the right treatments that are best for you. So I feel bad for doing this, but I also want to tell you guys something else. So a lot of times when injectors aren't comfortable treating the tear troughs, they'll do something that's a little bit easier with respect to the procedure that's going to kind of do the same thing, but not really. So injector will say, oh, no, you're not a candidate for tear trough filler, or you don't need that. What you do need is some cheekbone filler, because that's a way easier injection technique to do. And I see patients refer to me a lot that will have a ton of cheek filler, but their tear troughs are still there, and they'll say, well, my injector said I didn't need it here, I needed it there. And I'm like, let me translate that for you. They weren't comfortable doing it here, they wanted to do it there. So that's not in all cases, but I just want you to put that in the back of your mind to just keep in mind. And with my patients, if someone truly does need cheekbone filler, I will go over that with them, and I'll hold the mirror in front of them and we'll talk it through. But if someone's pushing you to one thing that's not what you came in for, just keep that in mind too. And again, I hate to be like the derm police, but I've been doing this a very long time, and I went through a lot of training to get here. So I want to, and there's people on every street corner these days, especially I'm in Orange County, who may not have had the training, and they're actually practicing on real paying patients. So I just want to make sure that you guys are educated and that you're, fully ready to have the best treatment by the most qualified injector and have the results that you love and that you want. And so I'm probably going to get a lot of mean comments on this, but I do patient satisfaction and patient benefit and patient health, and minimizing adverse reactions and safety is everything. So that's the whole reason why I do this whole YouTube channel for you guys. And if you're following me, I know that you're diligent enough with your research, and you're into it enough to where you're going to only be treated by the best of the best. Okay, so although I've gone on a couple tangents tonight, I want to just kind of recap what we said. So dark circles from pigmentation, we can lift that pigment with lasers. Volume loss or hollowing or shadows being casted under the eyes from anatomical variations or loss of volume with age, we can use fillers. Vasculature under the eyes, you can use a vasculature laser like a V-beam or a KTP or an XLV. And last but not least, what we didn't talk about is eye serums. So eye serums are really important because the skin under the eye is very different from skin other areas of the face. Like I mentioned before, I'm not a big retinol fan for use in eye serums, nor am I a vitamin C fan for eye serums. Eye serums are really important to have certain key components that can help minimize the appearance of not only fine lines and wrinkles, but also to minimize the appearance of under eye dark circles and puffiness. So things that like vasoconstrictors, so green tea polyphenols, natural antioxidants that kind of close down on the capillaries and make them not so ectatic or widened or dilated. Niacinamide, certain antioxidants that help vasoconstrict, and things like caffeine that help minimize the appearance of under eye dark circles can really, really be beneficial. And they also help with lymphatic impedance to relieve that, so you don't have like the under eye dark circles and puffiness. So looking for those key components in an eye serum is really important too. And then you have the key ingredients that are going to help stimulate collagen and elastin to help tighten up that skin and to minimize the appearance of fine lines and wrinkles. And in engineering my ECM eye serum, like that was very important to me, because I wanted to not only address under eye fine lines and wrinkles, which yes, of course we want to do that, but to minimize dark circles and under eye puffiness too. And just because I'm here and I'm home, because usually when I'm doing my videos, I'm in my office, but this is how, so for example, we're going to be launching a neck cream really soon. I think it's really fun to see all of the different flavors, how my amazing scientist who I formulate with, who sends me these different formulations, and we just get it exactly the way we want it, and we run assays and all kinds of analyses, so it takes forever to develop a product. So I can say on both sides of the fence, having an eye serum with the appropriate components in it to help minimize the appearance of dark circles can really do a lot too. An eye serum or a topical is not going to do as much as an actual treatment like a laser, but what you do at home is really important too, to kind of complement procedures that you have done in the office. Or if you're very procedure adverse, which is totally fine, and you just want to use skincare products that can, do the most that they can, then, that's really important too. So thank you for spending the evening with me. This was so fun. Look, I'm drinking my tea, and it's been just fun to just do this video off the top of my head and just kind of talk about a topic that came up today, and I will continue to do so. So let me know what you want me to talk about. Be sure to subscribe, hit the notification bell, and I will see you guys soon. Thanks.